Hey, it's Dominique Well from Well Medical Arts, and today we are going to teach you about the anatomy of the lip. Allergan, the makers of Juvederm, has confirmed that the lips are the number 2 things people request, so we wanted to get out and really educate people about the lips and what areas can be done. So take a look at our beautiful patient care coordinator and talented, thank you. And look at the beautiful smile on lips. So I wanted to show you all of the different areas, starting with what we call perioral, and that means around the lip. So some people will have these little fine lines around the mouth. People call them little lipstick lines. Yay, Leslie doesn't have any yet, but make a little pucker for me. So eventually these might start to show up. We'll prevent that from happening for you. We actually can prevent that from happening by using a tiny bit of Botox right to the upper lip. The lip muscle goes all the way around the mouth. It's called the oris, and it's a circle, and it tightens and puckers. So when we put that little bit to the upper lip, that's called the lip flip, and that will just make it boop, turn up a tiny bit. Very, very sweet. Nobody will notice. You can also put a couple of units of Botox to the bottom lip, make it pout out just a little bit. And then this muscle down here makes these marionette lines, and that muscle is called the DAO, the depressor angularis oris. You can put a little bit to the corners of the mouth to make it turn up sweetly, and then show me your bottom cheek like this. See these pockets down at the bottom? You can put 4 to 5 units down at the pockets of the bottom. Now relax. This muscle is a depressor. It's the strongest depressor in the lower face. It pulls down, and so when we relax it, it does the opposite and lift up. The other thing that we can do around the mouth is just a couple of units into the nasolabial fold so they don't get any deeper. And then see how she has just tiny bit of chin dimpling? You can also do just a few units into the chin. So, and that will smooth out a little bit of dimpling. So all that is what we consider perioral. Now, regarding the actual structure of the lips, starting up here, there's 2 little seams, and those are called the philtrum. And then there's this beautiful, she has this lovely little teardrop shape right inside. You always want to keep that. And on some people, as we age, the space in between the nose and the lip lengthens. So when we go in and do that little bit to the philtrum and make that seam a little stronger, it will lift up the lip. Also, you can put just a tiny bit of filler sort of right underneath the nose, and you can see that would help efface or roll up the lip. Sometimes doing a nasolabial fold will also help efface and roll up the lip a little bit. So that's the around the lip structures. Now, when you look up close, there's a little bit of a white roll all the way around the mouth. See that little bit of glistening white? That's a beautiful thing. You want that to show. That's where we will accentuate. This area is called the Cupid's bow. So we'll go in and make the seam of the Cupid's bow tighter. And then we can also go around. The red roll is called the vermilion border. We can also make the seam of the vermilion border protrude a little bit more. You can do the lips with or without the vermilion border, depending on whether somebody wants a crisp, defined lip or a more natural lip. To go in and do a more natural lip, drop the bottom jaw just a tad for me to open the mouth. There we go. We go in and we can do the body, what's called the tubercles, and sometimes people will call them the pillows. You can go in and just do a little bit of the body, and that looks very, very natural. We also do what's called the wet to dry. As I pull down on the bottom lip, you can see there's a juicy wet part, and then there's a dry part. That's called the wet to dry border. And when you put a little bit in that wet to dry border, same thing, getting that to efface, to roll up again. So we can do as little as just cleaning up a little bit of perioral around the mouth and not doing the lips at all the way to using all the tools that we can to make that face really efface and to project out. You have beautiful lips. I wouldn't do anything to them.